This program is brought to you by Emory University.
But today we'll talk about Trump and healthcare and Trump and race. And we have two fabulous presenters and facilitators today. Linda McCauley, who is the 6th Dean of Emory University's Nell Hodgson Woodruff School of Nursing. Dean McCauley is a member of the National Academy of Medicine and the American Academy of Nursing. She is internationally recognized for her nursing leadership and scholarship in environmental, occupational, and public health. She has been consistently funded for the past 2 decades, studying a number of compelling issues in environmental health, including exposure of children to pesticides, the special health risk to adolescent workers, and interventions to decrease pesticide exposures in vulnerable populations. Dean McCauley speaks nationally on issues facing the healthcare force, including new models of care, interprofessional education, and emerging academic practice partnerships. Since 2010, she has been consistently named by the Atlanta Business Chronicle in their Who's Who in Healthcare category. She is a leader of the Georgia Nursing Leader Coalition that works to highlight the role of nursing in advancing access to high-quality self-health care for all Georgians. She actively influences national health policy through her membership on the Board of Population Health of the National Academy of Medicine, and she is also my dear friend. Andra Gillespie is Associate Professor of Political Science and Director of the James Weldon Johnston Institute for the Study of Race and Difference at Emory University. She earned her PhD in Political Science from Yale University. Gillespie teaches courses on American politics, race and politics, and qualitative methodology. She is the author of The New Black Politician, Cory Booker, Newark and Post-Racial America, and the editor of Who's Black Politics, Cases in Post-Racial Black Leadership. Professor Gillespie is currently completing a project about the representation of Black interests in the Obama administration and is co-authoring a project about Black Republican Party identification. So please join me in welcoming our facilitators today.
Good afternoon, everyone. So I think if I sit in this chair, it's so low. Can everyone see me? Or should I stand? Is it better to stand? And then,
you may do whatever you want.
I'm going to stand so I can look out and see you. And it's very difficult for me to speak for 20 minutes without having a discussion, but I'm going to try. And this is not an easy topic. Well, anything that deals with Trump and what's going to happen is not an easy topic. But it is an area that, as a dean of a nursing school and a member of the Woodruff Health Sciences Center, that I've been paying a lot of attention to. In fact, someone asked me to write a paper. They contacted me in December and said, will you write a paper on healthcare reform in a turbulent environment? And so I said, oh, okay. So I wrote that, and it was published last week, week before, and then Linnell called me when I had finished writing it and said, can you do this talk? And so I thought, well, it's certainly on my mind, the things I want to say to you. So there's a quote that I think kind of describes how I feel about this. Prediction is difficult, especially if it's about the future. And that is really kind of where we are today with so many things in our new administration. But healthcare, what you're hearing is repeal of the Affordable Care Act. Well, you probably have all seen the interviews on television that the public, many people did not realize that the Affordable Care Act and Obamacare were the same thing. So there's a lot of confusion around this area. And I'll give you an example, and this is very personal. I have a sister who lives up in North Carolina, and she struggled all of her life, and her husband's a veteran, so he gets his care through the VA. But she was an administrative assistant for when her kids were little, and she worked part-time, so she never really had great health benefits. When her husband worked, she didn't have to really worry about it. But now that she's 62 and not eligible for Medicare yet, but her husband has care from the VA, all of a sudden she can't figure out where to get her health care. And she said, well, I love the clinic. The physicians are so wonderful at the clinic, the neighborhood clinic. First of all, she has no concept that a federally qualified clinic is federally funded. It's exactly the type of thing that Trump probably is not very supportive of. So she has no idea where this pay, she pays on a pay scale. She has no idea how that was set up, anything about it. And so she said, I love going to the clinic, but I needed some of these diagnostic tests, and my bill was $10,000. And she said, I can't pay that. She said, so I went online, and she said, I tried to enroll in Obamacare, and she said they wanted to charge me $407 a month. And she said, I can't afford that. This Obamacare is crazy, it's not good. And I stopped her and I said, Joanne, you need to stop blaming Obama, and you need to start blaming your governor. Because your governor did not expand Medicaid. You should not be paying for your health care. But it was just like over her head. So she voted for Trump. She voted for Trump, really believing that Obamacare had caused our health care costs to go up. She blamed Obamacare for her $10,000 bill for diagnostic tests. And so there's a lot of confusion in the public and a lot of finger pointing. And the important thing to know is that the cost of health care is going up. Per capita, it is nudging $10,000 per capita, per person a year in the United States. That has nothing to do with the Affordable Care Act. That's the cost of running health care and the cost of medications and the cost of diagnostic tests. And so this is really not going to go away. If the Affordable Care Act was totally repealed next week, these costs of health care, unless we come up with a different way to care for the people in the United States, these costs are going to continue to rise. So people in general don't understand the cause and effect thing. What we do know is that Affordable Care Act actually decreased the escalation of cost. It still went up, but it wasn't going up as dramatically as it was. There's another thing that's happening in healthcare, a movement away from fee for service. How many of you have had family members or something that go and get care, and maybe your surgeon says, okay, that day surgery on your knee is going to cost you $10,000, and your insurance is going to cover all but $1,500 of it. And so you walk away and you think, okay, that's going to be my bill. And then all of a sudden, in the mail, you get these other bills. So someone who read this x-ray or and so all of a sudden, that's fee for service, where they just keep adding on to your tab. It's kind of like when you go to a restaurant and you order iced tea, it's kind of important to know whether your refills are free or you're going to be charged for each one, right? Well, in healthcare, you're charged for each one. And so the term that they're trying to do now with value-based care is bundled payments. In other words, here's the cost, and you no longer see these added costs added to it. That has nothing to do with the Affordable Care Act. They're two separate things. And what's important to know is regardless of what happens to health care, these changes with bundled payments, quality, access and quality, they're going to continue to be the drivers for health care. So it's very complex and not easily explained to a lot of people. But let's talk about the Affordable Care Act, because ever since Trump ran for office, it was, I'm going to repeal that horrible Obamacare. So what are the things that people like? And you've heard that Obamacare was set up like a stool, a three-legged stool, and you can't just cut off one of the legs and expect for it to still stand up. That these things were constructed in such a way to make it work. And that's why Trump goes, I never knew it was so hard.
It's complicated.
It's complicated, right. And so right now, people in town halls are saying, don't get rid of the things we like. The problem is how can Trump build a stool that can stand up without one of the legs? That's the problem. And so let me see what I can tell you about that. What's popular? I thought this would be a younger group.
Wait a minute.
So I thought you would be a group who probably wasn't worried about much of anything other than staying on your parents' insurance, but I guess I'm speaking to a different generation. A few of you might be in a different generation. Clearly, allowing young people to stay on their parents' coverage until the age of 26 has been tremendously popular. And I can't imagine their being able to touch it. How many of you personally know someone that's benefited? Yeah. And you know what? It doesn't cost much. Adding one more person to a parental plan, 22 to 26-year-olds are not high users anyway, unless it's catastrophic and that's horrible. But that was a very positive thing, and you wonder why, if it's so positive, what stopped them from doing it in the first place? Why did it take this act to have that done? The second popular thing is insuring individuals with pre-existing conditions. So I have a son who, when he was 17, was snowboarding up in Oregon, and he was doing a 360 and fell and fractured his femur. And so I had insurance, so that wasn't an issue, and he had a very expensive surgery, a titanium rod, great recovery, and went off to college. And when he was 22 and he was graduating, he was thinking, because he had had that catastrophic injury, health insurance was important for him, right? And so he says, he said, I want to get my policy. This was before he could stay on my account. And so he found out he was uninsurable for two reasons. One, because of that pre-existing condition. Even though he was running races, he had totally recovered. He wasn't far enough out from that injury. And two, because he was a guitarist and he was at risk for carpal tunnel. So he was uninsurable. could not get insured in the state of Florida. He moved to Tennessee, moved to Nashville, and he was able to get insurance there because insurance doesn't cross state lines, right? So what you find in one state may not be what you find in another state. So he was able to buy a policy for $91 a month, and he's happy as a clam. And when the Affordable Care Act was passed, I said, Johnny, did you go online to get a policy? And he said, I don't need to. $91 a month, I'm fine, Mom. I'm fine. And that's what we want every young person to say, is I'm fine. I got it, Mom, don't worry. And so, so that was great that people with pre-existing conditions could not be denied insurance. And prevention care might not mean too much for men, but for women, it is huge. Because I can tell you, there are women who will not get a mammogram or a pap smear if they have to pay for it. Because we don't particularly like that anyway. It's like, okay, if it's free, I'll do it. But generally, you know, I said to someone, I said, I'm not paying $400 for a pap smear at my age. I'll go buy a pair of shoes. It's all about choice. It's been so popular for women. And that's something that really is under fire to go away. And then no lifetime cap. Used to be insurance would cap how much they would pay out for anything. So if you developed cancer and then another cancer on top of that or whatever, all of a sudden you got a letter from your insurer saying, sorry, you've reached your lifetime cap. And so the Affordable Care Act did away with that so that people weren't put out on the streets. And this causes homelessness when you tell people with catastrophic illnesses that they no longer have insurance. So those are popular things people really don't want touched. The unpopular aspects, the individual mandate, it amazes me that individuals believe their rights are being infringed upon to require them to have health insurance, when they have no problem understanding that to drive a car they have to have insurance. Some people have problems understanding that to put your children in school they need to have vaccines, that you have to fasten your seatbelt when you drive, that you have to follow rules. But for some reason, people can't opt out of bad health. You can opt out to not drive a car. You can opt out, not to own your home and the things that you have to do, and if you have own a home. But you can't opt out of getting sick. We have no control over that. And so for people who don't want insurance, they're basically saying, I'm okay with you paying for me, or you paying for me. Because believe me, the people who don't want to pay for insurance do get sick. And they do show up in EDs. And they're part of the reasons why we haven't been able to control healthcare costs. So, but it's unpopular. The whole Medicaid expansion, that's a whole ethical discussion maybe we can get into, that people have to choose. I remember talking to a health policy person from Alabama, and she said, Linda, you don't understand. The state of Alabama can't expand Medicaid. Our schools are broke. We have no money for Medicaid. Our schools, money has to go to our schools. And I said, it's a pretty sad situation in a country that you have to make a choice between education or health care. Rising costs for some policies. There are some people whose premiums have gone up, mainly a lot of them because Obamacare did not allow these policies that didn't cover anything. They were cheap, but they didn't cover much. And so, and a limited network. So we're in this game with insurers now. It's a real interesting situation of threatening not to play unless they get their way. And that's what's going on. So I just want to say, I hope all of you understand the value of prevention, and that the prevention fund in the Affordable Care Act was from the very beginning called Obama's slush fund. That was what they called it. That these things that would do things like invest in wellness and prevention, waiving the cost for preventative services, providing new funding for community prevention services, like trying to decrease violence in neighborhoods, trying to control gangs and homicides by gun deaths. That was slush. And creating workplace programs, whether they be where people work or where people study. That was kind of the whole prevention area of the Affordable Care Act. It's very important. There's a lot going on right now about the aging population and chronic diseases. And this is what we are going to see next week, this week. It's really kind of interesting about the way they're going to handle it, because it is the most expensive issue around health care. It's our aging population with tons of chronic diseases. And so if to have any chance of passing, they can't get rid of the pre-existing condition restriction. They can't get rid of that, but they can do other things. And all I can say to you is watch that carefully, because they're talking about things like high-risk pools and how financially they would be handled and subsidized by the government. And so quite simply, most people over 55 are going to be in the high-risk pool because they're going to have some chronic conditions. And there are things like, as long as you're employed, so like I work for Emory, I'm in a high-risk pool, I have chronic arthritis, and maybe I got a heart condition, and maybe I got type 2 diabetes, and I work for Emory, and I'm good as long as I'm covered by Emory. But if for some reason I had to stop working for Emory tomorrow, that's when things happen. That's when they can change things, and they can put me in a high-risk pool, or they can say, because you lost your coverage, you have to go 3 months before you're insurable again. And that doesn't, that just sounds like a pain, right? But really, if you look at the whole population, huge savings for insurers to keep these people off their rolls as long as they can. So it's not quite clear what's going to happen there, but it is something that is very complex. And then I also, because I'm a public health person, I want to talk to you about some other things that are going on right now that are part of health. That when the director of the EPA doesn't believe in science and doesn't believe in industrial regulations, we need people who work and study at Emory to talk about the connection between environmental health, the environment and health. And all you have to do is look at asthma admissions to EDs to see that connection. So that's going on, and we need to look closely at that. I've already mentioned the healthy community initiatives. And then the last thing I want to talk about, which I think is very important for our community, and I think it's connected to health and healthcare reform, and that's the workforce training. So some of the debt that medical students take on, and nursing students, and physical therapists, and pharmacists take on, they're in federal programs that help subsidize healthcare education. And if these go away, it's going to be very difficult for us to continue to educate the numbers of future healthcare providers. And that's really, really dangerous when you consider our population pyramid is going from this to this. And if you don't have the healthcare providers holding that huge population of aging up, we're in a terrible situation. So it's more than just the Affordable Care Act. There are other things that are going on under the Trump administration that are connected to health. And so maybe we'll have a chance to talk about that, but I think my time's up, isn't it? It is. So, thank you.
Well, thank you for participating in this, and thank you for inviting me today. I want to do a little bit of reflection about how we got to this point, and then right at the end, I'll talk a little bit about what has happened with respect to race in the first 100 days, and then we can use that as a jumping off point for questions. So in general, we need to talk about race in American elections because race has been invoked in American elections from almost the founding of America. So for instance, we could always think about the ways that state constitutions, especially around the turn of the 20th century, built racial hierarchies. So first, blacks were excluded because they weren't really considered citizens in the United States. They were enslaved, and if they were free, they weren't considered truly citizens of the United States. And then even after they got their 15th Amendment voting rights, southern states, including this one, figured out ingenious ways to prevent blacks from being able to exercise their rights to vote. So it's not just segregation to think about, but it's also things like poll taxes and literacy tests and other kinds of things. Candidates have been invoking race in American elections for more than 200 years at this point. So for instance, we could go back to the election of 1800, where journalist Thomas Callender goes after Thomas Jefferson on behalf of or in support of John Adams in the 1800 election, and is the first one to really make public the fact that Thomas Jefferson had a relationship with Sally Hemings. So this is an editorial cartoon of the time. So you see Thomas Jefferson as the rooster with the black hen of Sally Hemings. We see this almost rupture the Democratic Party in 1948. So in 1948, when Harry Truman successfully gets a pro-civil rights platform, plank added to the Democratic Party platform in 1948, Strom Thurmond leads deep Southerners out of the Democratic Convention in revolt, and he runs against Harry Truman with the States' Rights Democratic Party, also known as the Dixiecrat Party, leading to 4 deep Southern states voting for him as opposed to Harry Truman, making that race closer than it needed to be. And at the height of the Civil Rights Movement, as the Civil Rights Act is being debated, the Republican Party nominee Barry Goldwater runs for office while opposing as a U.S. Senator the Civil Rights Act. Now, he did it on libertarian grounds, thinking that that would make the government too intrusive and too big, and it would allow government to do what the market, he figured, would be able to do. But what starts to happen is that it starts to create a space to talk about racial issues using a non-racialized language of states' rights and sort of making sure that you keep federal authority limited. That starts to appeal to Southern Democrats who start defecting over the next 50 years from the Democratic Party to the Republican Party. And this becomes more sophisticated in the late 1960s with the emergence of the Southern strategy. So this is a strategy that has been acknowledged by the Republican Party. that was targeted to whites who were upset with the Civil Rights Revolution. So it's called the Southern Strategy because it was intended to target the South, but it wasn't limited by any means to the South. So for instance, I like to characterize the target voter for 1968 and 1972 as an Archie Bunker style Democrat. And so if you know All in the Family, Archie Bunker lived in Queens. He didn't live in Alabama. And so this target or this strategy was intended to reach out to them by using cues that were not going to be explicitly racialized. One of the accomplishments of the civil rights movement was it changed our social mores, so you could no longer talk about the biological inferiority of blacks. You couldn't talk about de jure segregation. So instead you have to use other methods to reach out to voters. So you might say stuff like law and order, and so that's code for we need to get those blacks who are burning cities down in line. Or you don't say that you're pro-school segregation, you say that you are anti-busing or you are pro-freedom of choice. My father liked to call that freedom to choose not to go to school with black people. You could, you just use subtle things that don't explicitly say race, so you're not going to, be George Wallace saying, segregation yesterday, segregation today, segregation forever, but it conveys the point, and people can figure out very clearly what it is that you have to say. And these types of strategies carried forward even into the modern era. So some of you may not remember, but I know some of you do remember the 1988 presidential election. And you'll remember the infamous Willie Horton ad, where we all know now it was Lee Atwater runs this ad that said that Michael Dukakis let prisoners out. And so you have a picture of the scary looking black dude. So all it says is that it lets prisoners out, and this guy, Willie Horton, gets out of prison and holds a couple hostage and rapes the woman in the couple. And so you don't need to say, Michael Dukakis lets scary black dudes out of jail. You just tell the story and you show the picture, and it has the effect that it needs to have. So this is part of the reason why we were surprised by the emergence of Donald Trump. So if this works, I'm going to show you a little clip from Saturday Night Live that talks about this.
Thank you.
All right, there we go.
Thanks for having me. Now, that's right, America, I'm back. You didn't ask for it, but you got it. Now, Governor, why have you decided to speak out against Donald Trump? Well, Jake, for the last 9 months, I've sat down and watched Donald Trump say something every day that was either racist or sexist. And we in the GOP, the party of the great Ronald Reagan, we do not say racist and sexist things. We imply them. Subtly over decades and decades of policy. So I felt that I had to take matters into my own tanned, well-manicured hands and follow the advice of my favorite rapster, Macklemore. That's right. And I chose to put Donald Trump on blast. America, he's a fool. 4 years ago, he endorsed you for president.
Okay. So you got the point. All right. So in many ways, we were surprised by this because we had been taught by political science theory that America was past the point where you could overtly appeal to race. The days of George Wallace were over. And when Donald Trump emerges and he starts his campaign off by maligning Mexicans, most people didn't take him seriously because they were like, oh, people's radars are going to go up. This is going to trigger people's mores about not being explicitly racist in public, and they know that that's bad, and they'll shy away from it. And then it turned out that he got elected president, and we had to rethink all of those theories that we had heard about implicit and explicit primings. So let's think about some of the things that we know from the electorate based on racial attitudes in 2016 vote choice. So if we look at exit poll data, and we look at the vote distribution by race or ethnicity, we see some patterns that were actually part of a long-term pattern of voting behavior in the United States. Mainly that there's racial polarization in American politics. So a majority of whites vote Republican, and a majority of people of color vote Democratic. And this has actually been the case for a number of years at this point. In 1992, for instance, Asian Americans were vote half Republican, half Democratic in elections. By 2012, they were voting almost 3 to 4 for Barack Obama, and in 2016, they were voting nearly 2/3 for Hillary Clinton. Latinos tend to split their votes, usually about 2 to 1 for Democratic candidates, and while though this wasn't as high as it was in 2012, the exit polls suggest that this impact did happen. And African Americans, who traditionally vote about 90% Democratic in presidential elections, continue this trend, voting 88% for Hillary Clinton. That's actually relatively normal. Barack Obama was the outlier, so the idea of getting 95% of African American votes, that was mainly a function of Barack Obama running for president and just the historic nature of the first black presidency. If we look at age and we look at racial polarization to see whether or not this actually holds true for younger Americans, while not as stark, it is important to note that those patterns are actually still true even if we look at millennial populations. So while not a majority of white millennials voted for Donald Trump, a plurality did. And this is the case if we break it down by gender. We know college-educated white women voted for Hillary Clinton, but overall white women voted for Donald Trump. Through the James Weldon Johnson Institute, we collected survey data on November 7th and 8th, and it's unweighted, so I'll warn you about that up front. But here is what we look at right now. So if I just break it down from Clinton voters to Trump voters, knowing that we've got oversamples of all different types of group minorities and millennials that I need to weight down, what you'll see is that Clinton voters are much more likely than Trump voters to say that America is better off today than it was 8 years ago and better off today than it was 50 years ago. And we kind of leave that vague. But what this connotes is that Trump voters were voting out of a sense of nostalgia. And they thought that life in 2016 was worse than it was in 2018, and it was certainly worse than it was in 1966. And there could be lots of things that they may be upset about as a result of that. If we look at Clinton voters and Trump voters and then compare their attitudes about certain reasons to vote against Trump that invoked his misogyny or invoked his racial insensitivity at best, what you see are these really stark divergences in terms of what people think. So the blue lines indicate Clinton voters and the red lines indicate Trump voters. And so only about a seventh to a fifth of Trump voters would concede that things like birtherism or attacking Khizr Khan and his family or his endorsement from David Duke and other members of the Ku Klux Klan were really good reasons to vote against Donald Trump, whereas you would see upwards of 50% to 60% of Clinton voters suggesting that some of these various issues would be reasons to vote against Trump. We asked Trump voters what they thought about political correctness, and Trump voters were usually more likely to say that people were too concerned with being politically correct, and even if they wouldn't admit it for themselves, they said that other people were usually too afraid to say what they really thought in public. And this relates more to standard measures of racial resentment. So 4 of these questions are standard questions that typically get asked in many political science opinion surveys about whether or not people hold symbolically racist attitudes towards blacks, because you're not going to get many people in surveys making comments like, do black people come from monkeys or other types of things. Like, people know better than to make those kinds of comments, but they will express views that we typically think of as being racially resentful. So 4 questions that get asked most of the time are, well, if blacks would try harder, they would do just as well as whites. White ethnics have done well in American society, blacks would too if they just worked hard. Slavery and discrimination make it hard for blacks to get ahead. And blacks have gotten less than they deserve. And so what you can see is that there are still these divergences that would suggest racial resentment. And to this, I've added this notion that immigrants take jobs away from American citizens. And that's where you also see some of the largest divergences, with 87% of Trump voters in this unweighted sample who say that immigrants do take jobs away from American citizens, compared to only about a quarter of Clinton voters. All right. So I also asked in the survey about what you would consider to be racist and what you would consider to be sexist. I'm only going to talk about the things that would be considered to be racist for this talk, just in the interest of time. And so it included things like obvious racism, like calling people racial slurs, denying people access to public facilities on account of their race, committing hate crimes against people because of their race. And those are the ones that are at the bottom. And there, while you do see some differences, you don't actually see particularly large differences amongst Clinton and Trump voters. So there's a consensus on basic stuff like segregation is bad. You shouldn't commit hate crimes against people. But where it starts to become different is when you start to add other issues. So Trump voters were less likely to see that denying President Obama's ancestry, claiming that he was born outside of the United States was racist. Like, there were divergences on that. And there was more of a reluctance to identify structural problems necessarily as being racist. So if we talked about issues like environmental racism, if we talked about food deserts, even Clinton voters sometimes had a hard time recognizing these things as being racist, but they were more likely to view them as racist than Trump voters. And then if we talked about some of the catchphrases that President Trump used in his campaign and whether or not those were viewed as racist or sexist, you can see that there are also differences. And so even here, it's not necessarily that Clinton voters view these things as being racist or sexist, but that they're more likely to view them as being racist or sexist than Trump voters. So for instance, law and order is not something that most people would automatically recognize as being racist, but only 4% of Trump voters thought that was racist compared to about 23%, excuse me, of Clinton voters. If we looked at the nasty woman argument, for instance, 75% of Clinton voters viewed that as sexist compared to only about 22% of Trump voters. There was a greater consensus about the Access Hollywood comments, but you still see some differences there. And the notion of Make America Great Again. So 5% of Trump voters said that that was racist compared to 31% of Clinton voters. So let's think about the things that have happened so far in the Trump administration. So if you had to look, at least as far as African Americans are concerned, he hasn't done much. I wouldn't call it benign neglect, but the things that President Trump has done so far have been mostly in the realm of symbolic politics. And even though you may argue that he's done them poorly, they just really haven't there hasn't been a whole lot of policy focus on issues related to African Americans. So he's made a couple of photo ops, he made a speech about Frederick Douglass that didn't make any sense. He showed up, at the National Museum of African American History and Culture for a tour. He had a photo op with presidents of historically black colleges and universities. From a policy standpoint, he has threatened to send the National Guard into Chicago, hasn't done anything with respect to that, and so there haven't really been any initiatives that we've seen come forth that look like they're particularly targeted to African Americans. Now, there are other things that we can look at and talk about. So, for instance, things that would appear, because of how we tend to think about these issues, to directly affect Latinos, to directly affect Asian Americans, have been on the front burner. So, for instance, the deportation policy is clearly a policy that's racialized, and that is actually racializing these populations perhaps more than they were before. Thinking about the travel ban and how that's racializing Asian Americans in a way that they hadn't necessarily been racialized before, particularly if you're South Asian American, if you're Arab American, but then also people who are Muslim. So this is a religious identity that's becoming increasingly racialized. And then we could think about what the policy impacts are about some of the economic policies that have been put forward, particularly with respect to healthcare, and who's more likely to be negatively impacted by changes to the ACA. Since minorities were disproportionately underinsured before the ACA, it would stand to reason that they might be disproportionately affected by changes to the ACA if they are able to pass. And then there are even smaller things. So for instance, if the government shuts down this week, minorities, African Americans in particular, tend to be disproportionately employed by the public sector. So at least temporarily, that's a couple weeks or a few days or however long it is without paychecks. And so those are all things that people would tend to think about when they're looking at the administration. So I'll stop there so I know that we can have questions, and thank you for your time.
The preceding program is copyrighted by Emory University.